Hi, my name is Dr. Stella Jeffries. Today I will be discussing opioid drug abuse, a global crisis. But first, I would like to give a medical disclaimer. The information in this podcast are for educational purposes only and does not substitute professional medical advice or consultation with your healthcare providers. Opioid drug abuse is a global issue. While it has received significant attention in some countries like the United States and Canada, it is also a concern in Africa. Opioids are a class of drugs that include prescription painkillers like oxycodone, hydrocodone, tramadol, cough syrup mixed with codeine, as well as illegal drugs like heroin. Opioid use disorder is also classified as substance use disorder. Substance use disorder, including opioid use disorder, are complex health issues that require evidence-based treatment, access to health care, and supportive services. It is generally recognized that a compassionate and comprehensive approach that includes harm reduction strategy, access to effective treatment, and community support is most effective in addressing substance use disorder. It is very distressing to hear about the current situation where patients in Africa diagnosed with opioid use disorder are subjected to inhumane treatment, such as being locked in chains, while, on the contrary, patients in the West diagnosed with opioid use disorder are placed in appropriate rehabilitation center for treatment. Since the World Health Organization, WHO, is a global organization that works to address public health issues worldwide, including substance use disorder and misuse of opioid, why is it that the crisis in North America regions receives significant attention as compared to the crisis of the substance abuse in Africa? Although the response to the opioid crisis can vary across regions due to differences in prevalence of opioid misuse, availabilities of data collection, healthcare infrastructure, and resource allocation, no group of people should be treated unfairly while others with the same conditions are receiving quality medical care. As we are aware, the World Health Organization role in addressing the opioid crisis involves providing guidance and support to members' countries in developing policies, implementing prevention programs, improving access to treatment, and promoting safe and rational use of medications. And the organization also collaborates with governments, healthcare providers, and other stakeholders to strengthen health systems and improve the availabilities and quality of addiction treatment services. However, the opioid use disorder treatment modality for Africans in Africa with substance use disorders are unfair and are human rights violations. Although in some part of Africa there are limited access to health care and inadequate medical infrastructure can contribute to misuse of opiates, this can include improper prescribing practices, lack of monitoring, and insufficient addiction treatment services. Opioid abuse in Africa is driven by multiple factors, including the availabilities of opioids, both legal and illegal. While some opiates are legitimately prescribed for pain management, there is also the issue of illicit opiate entering the market. Opiate misuse and abuse occur when individuals use opiates for non-medical purposes or without a valid prescription. This can include using prescription opiates recreationally, drinking cough syrup with codeine daily, obtaining them illegally, or returning to illicit opiates like heroin. Cough syrup misuse and abuse, particularly those containing opiates, is a concern in certain parts of Africa. Cough syrup containing codeine or mild opiates are commonly available over the counter. The unrestricted access and misuse of this cough syrup has raised some serious concerns. Some individuals misuse codeine containing cough syrup for recreation purposes, seeking its sedative and euphoric effects. Raising awareness about the risks associated with cough syrup misuse is crucial. Public health campaigns targeted towards healthcare professionals, parents, and community can help educate individuals about the potential dangers of opioid abuse and promote responsible use. Government can strengthen regulations and enforcement mechanisms to control the sales and distribution of codeine containing cough syrup. This may involve stricter prescription requirements, limiting quantities, and monitoring sales to prevent stockpiling and diversion. Healthcare professionals should receive training on responsible prescribing practices, recognizing signs of misuse and providing appropriate intervention and referral for addiction treatment. Expanding access to addiction treatment and support services, including counseling and rehabilitation programs, is essential to assist individuals struggling with cough syrup opiate misuse and help them recover. Collaborating between African countries, international organizations, and pharmaceutical companies can help implement strategies to address cough syrup opiate misuse effectively. Sharing best practices, exchanging information, and coordinating efforts can contribute to a comprehensive approach. It is important to note that while cough syrup opiate misuse is a concern, not all individuals who use this medication do so inappropriately. Many people rely on these medications for legitimate medical purposes. The focus should be on preventing misuse and ensuring responsible use while also ensuring access to necessary medication for those in need. Opioid treatment approach can vary between Western countries and Africa due to various factors, including healthcare system, cultural consideration, resources, and regulatory frameworks. Western countries generally have more developed healthcare systems with greater resources, specialized addiction treatment centers, and comprehensive insurance coverage. This enables a broader range of treatment options and services, including medication-assisted therapy and access to trained healthcare professionals. Opioid treatment approaches can differ between Western countries and Africa due to various factors, including healthcare system, cultural consideration, resources, and regulatory frameworks. Western countries generally have more developed healthcare systems with greater resources, specialized addiction treatment center, and comprehensive insurance coverage. This enables a broader range of treatment options and services, including medication-assisted therapy and access to trained healthcare professionals. In contrast, healthcare systems in Africa may face challenges such as limited infrastructure, inadequate funding, and the shortage of trained professionals, which can impact the availabilities and quality of opioid treatment services. The regulatory framework surrounding opioid treatment also differs between Western countries and African nations. Western countries often have well-established regulatory bodies, guidelines, and policies that govern the use of opioid medications, the provision of medication assisted therapy, and the licensing of treatment providers. African countries may have varying levels of regulations and guidelines in place, which can impact the availability and accessibility of these treatments. Western countries generally have a wider array of evidence-based treatment options for opioid use disorder, including medication-assisted therapy, counseling, and behavior therapies. Medications such as methadone, buprenorphine, and naltrexone are commonly used in Western countries to help manage withdrawal symptoms, reduce cravings, and support long-term recovery. In some African countries, the availability and accessibility of these treatment options may be limited, and reliance on counseling and psychosocial support may be more prevalent. However, the World Health Organization can now take steps to make this possible, to work with pharmaceutical companies to bring in medications like methadone, buprenorphine, Vivitrol, naltrexone, and other treatment modality for patients in Africa. The availabilities of resources and funding can significantly impact the treatment landscape. Western countries generally has more resources allocated for addiction treatment, research, and prevention efforts. In contrast, African countries often face resource constraints, limiting their capacity to establish and maintain comprehensive treatment programs. In contrast, African countries often face resource constraints, limiting their capacity to establish and maintain comprehensive treatment programs. Western countries, particularly those in Europe and North America, have been at the forefront of addressing the opioid crisis and have developed extensive network of addiction treatment center, research institutions, and organizations. The influence of research, best practice, and international collaboration can contribute to the development and implementation of effective treatment strategies. African countries may receive support from international organizations, but the scale and extent of support can vary. While it is important to recognize that Africa is a diverse continent with significant variation between countries in terms of healthcare system, resources, and opioid treatment may face challenge in some African countries, efforts must be made by the World Health Organization and other regulatory bodies to improve access to effective treatment, strengthening healthcare infrastructure, and raise awareness about substance abuse and addiction. It is important to note that the response to the substance misuse and abuse issue in Africa may involve multiple stakeholders, including government, healthcare providers, civil society organizations, and international partners. These organizations must collaborate to address the issue comprehensively through prevention, treatment, public awareness campaign, regulatory measures, and other appropriate interventions. Please like and subscribe to this podcast to get more information on the healthcare of the Black race. Thank you. Bye-bye.